Video, I will discuss the differences between chronic bronchitis versus emphysema. These both are actually chronic obstructive pulmonary disorders, but for your exam point of view, these should be differentiated. So, what is chronic bronchitis? It is defined as productive cough for equal to or more than 3 months for 2 consecutive years. So, in 2 consecutive years, you should have productive cough for equal to or more than 3 months. While emphysema is permanent enlargement and destruction of alveoli. So in case of emphysema, there is actually destruction and enlargement of your alveolar spaces. The main problem in case of chronic bronchitis is airway inflammation and mucus overproduction. So these patients have productive cough due to this overproduction of mucus. While in case of emphysema, the elastic tissue inside the alveoli is destroyed. Therefore, there is loss of elastic recoil of the lungs, leading to carbon dioxide trapping inside the alveoli, and this is due to alveolar destruction. So here you can see in case of chronic bronchitis, initially there is healthy bronchus, and then in case of chronic bronchitis you will see inflamed bronchus, which is narrowed. Here you can see it is narrowed, while in case of emphysema the alveoli are destroyed. Here you can see healthy alveoli, and here you can see inflamed destroyed alveoli who don't have elastic recoil and therefore hyperinflation of the lungs. The pathology underlying chronic bronchitis is actually mucus gland hypertrophy due to inflammation, and this is also characterized by goblet cell hyperplasia. So these both conditions can lead to increased mucus production. In case of emphysema, there is alveolar wall destruction. Alveolar wall destruction because of destruction of elastic fibers, and therefore there is enlargement of the air spaces. The phenotype in case of chronic bronchitis is blue blotter, while the phenotype is pink puffer in case of emphysema. In case of bronchitis, chronic bronchitis, there is severe productive cough, a lot of production of mucus and productive cough. These patients have mild cough, but they have more prominent dyspnea. So emphysema has dyspnea main problem, while in case of chronic bronchitis, severe productive cough is the main problem. In case of chronic bronchitis, there is copious amounts of sputum production. Emphysema has very little amount of sputum production. The dyspnea in chronic bronchitis is moderate, while in case of emphysema, the dyspnea is severe and progressive because of hyperinflation of the lungs. Cyanosis is common in blue blotters because it is named blue blotters. So chronic bronchitis has cyanosis, while emphysema has rare cyanosis because they are hyperventilating. Therefore they don't have prominent cyanosis. The chronic bronchitis patients are mostly obese, while in case of emphysema they are thin and have cachectic look. Breathing style of chronic bronchitis patients have no pursed lip breathing, while in case of emphysema they have pursed lip breathing because they want to reduce the workload on their inspiratory muscles. So these have pursed lip breathing, while chronic bronchitis don't have pursed lip breathing. Chest shape. In case of chronic bronchitis, there is slightly barrel shaped chest, or maybe it may be normal. While in case of emphysema, due to hyperinflation, the chest is barrel shaped. Emphysema has barrel shaped chest. Cor pulmonale occurs initially in chronic bronchitis because of early development of pulmonary hypertension, while in case of emphysema, there is late development of pulmonary hypertension because they have less hypoxia. They hyperventilate and therefore they do not desaturate as compared to the chronic bronchitis patients. Therefore they develop cor pulmonale later. DLCO, diffusing lung capacity of carbon monoxide, is normal in chronic bronchitis while it is low in emphysema. Blood gases. There is hypoxemia and hypercapnia marked in case of chronic bronchitis, but as I have told you that there is mild hypoxemia and almost normal carbon dioxide in case of emphysema, because the emphysematous patients are actually having hyperventilation. Therefore, these patients don't have hypoxemia severe enough, or they don't have hypercapnia. So they have normal oxygen and normal carbon dioxide most of the cases. X-ray findings. The X-ray findings in case of chronic bronchitis is actually increased bronchoalveolar markings. These are also known as dirty lungs. Dirty lungs are seen in chronic bronchitis, while there is hyperinflation of the lungs seen in emphysema. So in emphysema, there is hyperinflation of the lungs. Also, the lungs are inflated, therefore the diaphragm is flat. So due to this hyperinflation, the diaphragm is flat and the bullae may appear also in the lungs. Smoking has strong association with both of these disorders, but emphysema especially has strong association with smoking. And the added lung sounds, that is wheezing and rhonchi, are more marked in case of chronic bronchitis, but they are less frequent in case of emphysema. So mostly the added breath sounds are not seen in the emphysema, but these are observed frequently in case of chronic bronchitis. So this is all about differences of chronic bronchitis and emphysema. Thank you for watching.